Good day, everyone. I'm Anro Swart. I'm one of the developers on the Champ app, our flavor of CHT. Today, I'm joined by Dr. Arne von Delft, a medical doctor, the regional project manager of the Champ Precursor app, and the current site manager at Master Sandane, as well as Mr. Cleopas Hwinya, the data scientist, a former senior data manager with deep experience in ODK, and a driving force behind the uptake of our deduplication work. So the CHAMP project is one of the product-oriented delivery nodes within the Provincial Health Data Centre. It's part of the Health Intelligence Division of the Western Cape Department of Health and Wellness. Next slide, please. All righty, thank you. So the Western Cape is one of South Africa's 9 provinces, home to about 7.5 million people, of which around 5 million rely on the public health sector. Within that, we have a special focus on the historically underserved communities. So the informal settlements and impoverished areas where access to basic healthcare and services are limited, and where the potential for impact is the most urgent. Next slide, please. Alrighty. So where do we work and who do we serve? We predominantly work in 2 areas: Nomzamo, that's served by Matsisatane, and Bishop Lavis, that's served by TCN. So Nomzamo is relatively new and predominantly Xhosa-speaking community with a high rate of in-migration from different parts of South Africa, as well as other parts of Africa. The formal area is poorly developed with large numbers of informal dwellings and high levels of poverty. Bishop Lavis is an older, more established, predominantly Afrikaans-speaking community. The formal areas are more developed when compared to Nomzamo, but there are also still many informal structures and high levels of socioeconomic deprivation. Next slide, please. Both areas have limited municipal services and high rates of violent crime. The densely packed and poorly constructed dwellings are at an increased risk of storm damage, flooding, and uncontrollable fires. The areas are part of CHT, a collaborative healthcare and research initiative involving many academic institutions in Cape Town. It's led by the Western Cape Department of Health and Wellness. CHT combines routine, community-oriented primary care services with health and demographic surveillance as part of a broader South African population research infrastructure network. Quite a mouthful. Next one, please. So the people making this possible. At the heart of this effort are our CHWs, ably supported by the digital health officers, outreach team leaders, and the quality assurance officers. They operate in tough conditions, though, bearing witness to severe deprivation and suffering, while having to navigate cultural tensions, gang violence, and widespread disillusionment with the inadequate government services. Their commitment builds trust, though. It promotes better decision-making, improves data quality, and ultimately helps shape smarter, more responsive healthcare and preventive services. Our job is to make sure that CHAMP does not get in their way. It needs to be intuitive, reliable, and empowering. A tool that lifts burden and does not add to it. Next slide, please. So what do we aim to achieve? The primary aim is to improve continuity of care by enabling health workers to document and share important information, aided by useful decision support, and data integration. Historically, though, patient address data in our systems were too unreliable to support meaningful community-based care and follow-up. People were linked to facilities they visited, not where they lived. This skewed the understanding of the true burden of disease in communities and limited our ability to engage effectively and proactively. CHAMP fills that gap nicely, anchoring individual data to the places of residence so healthcare services can finally see what's happening on the ground, where interventions are the most necessary. Right, I think now I'll hand over to my colleague Cleopas, and he'll discuss some of the challenges.
Yeah, thanks, Andrew. Good afternoon. Okay, am I audible?
Yes, sir.
Oh, okay, thanks. Yeah, so I'll just be quick. So we started our baseline in November 2023 So as soon as we started the data collection, we actually noticed a spike in the number of dwellings and households and individuals that were duplicated. So when we take a close look, we realize that so some CHWs, when they previously when they were visiting the area that they previously collected information, they were creating new entries instead of just updating what they had previously collected. So when we took a closer look, we realized that sort of like the root causes were, I think there was some misunderstanding within how the search function works on the app, and also the ambiguous naming of some of the contact items would actually pose a challenge when you're actually searching on an app. So sometimes when they search and they couldn't find a match, they would actually create a new entries instead of just updating the existing ones. So also another issue that we noticed is there was sort of like a confusion between the distinction between what are dwellings or location within the system and households. So for instance, maybe when they get into a dwelling, which was supposed to be housing like 3 households, they would actually create each household on each as a separate dwelling. So they create a dwelling and then they create a household, which means now instead of having one dwelling with 3 households, you now have actually 3 distinct dwellings. So, and also, I think the other issue was there was a gap in training since all of them couldn't be trained at one go. So it would depend maybe if the training was not really standardized operationally in the field, it might happen that a particular group would present things in a, sort of like in a different way. So for instance, I've got this graph that I have here. So this is for individuals or household members. So what would you expect each person to be represented once in the system? You can see if this yellow line, but now when you look at 2, 3, and 4, so the pattern was, so you would actually have that you've got some individuals represented twice, 3 times or 4 times. And this pattern was not only for household or individuals, but it was the same for the dwellings and the house, the dwellings, the household, and the individuals as well. Next slide, please. Right. So right. Then another thing is what we noticed that these duplicates were not isolated. Actually, they were occurring across the 2 sites that we operate in, as Anro previously alluded. So we've got two sites. So the other one is Masnedani and the other one is the Caring Network. But when we looked, so it was just consistent across both sites. And then, so most of the duplicates were at a frequency sort of like of 2. So, and then 3, 4, 5. So in that descending order, you would actually get the less numbers. Percentage wise, you would actually see that on the dwelling with about 10%, 2% on the household, and around 1% on the individual. So this, okay, next slide, please. Right. Okay. So before we undertook the work to do the duplication on the system, so we tried some other means of trying to resolve this problem. So we had some training and retraining of other CHW. So in other cases, we could isolate the pattern to say it is actually these CHWs and do targeted training with them. And one thing that we did on the app itself, we tried to design some icons to better differentiate the different entities. Like I've alluded that some were confusing between what is a household and what is a dwelling. So we had what you call different icons to help them see the difference. But this was actually even not enough. And so on our case, we're actually doing a longitudinal study, which is going to run for several years. What problem that it would create for us would be, so for instance, we are almost done with our baseline, and then we are going to be visiting those households or those dwellings for several number of years. But now, if the main problem that we would have now is if we are going to go into those dwellings and households and they are duplicated like that, we wouldn't know which record to follow up. And even on our task list, we could cause some duplication that could also create issues with our participants and also cause CHW's fatigue. So I'm sure you can see on that image. So I just took it on one of our test system. But now, even from our production system, you actually notice that this is an example of a household. There wouldn't be any need for an individual who's having the same name, maybe middle name, same surname, same gender, same date of birth, to be duplicated within one particular household, which will also be the case like for dwellings. You couldn't have in one area where one CHW is working, there will be no reason why you would have more than one dwelling and so forth as we go to the household and the household members. Yeah, next slide, please. Right. Yeah, so I think I will hand over to Anro. You give us in detail what the feature development and considerations that we did.
Awesome. Thank you so much, Cleopas. Right, let's get into the making of. Our CHW were used to being notified of potential duplicates, duplicate entries in the previous app, precursor app that I mentioned earlier. It quickly became clear if we needed to replicate that information or that functionality, as our data quality was starting to suffer. So we explored several different approaches, one of which Cleopas actually alluded to earlier. We explored tweaking the search bar functionality. So to better support our context, we lowered the minimum character threshold for search triggers to just one character. We also expanded the indexing to include any string sequence longer than a single character. So this was necessary as many of our place names were short, ambiguous, and inconsistent. To maintain performance and align with CHW expectations, since only the name field is visible in that list view, we limited the index property strictly to the name field. However, this still didn't address the issue of typos and near matches, as fuzzy matching wasn't supported at the time. Second, we considered using extension libraries to perform lookups. But these run synchronously though, which meant we couldn't use them to query the database in real time. And even if we did find a workaround, we would have relied on unsupported and undocumented internal APIs. And that leaves us exposed to future breakage without warning. Finally, backporting the descendant of current contacts. At the time, we were working on an older version of CHT, and we couldn't benefit from those newer features. So we backported that functionality, but similar to the search, it didn't fully fit our needs. However, this built-in lookup question kind of inspired the official deduplication work. What we needed was something a bit more robust, configurable, and prominent. One that clearly alerted users to likely duplicates and invited them to act. That's what led us to step outside of the standard tooling and explore what was happening behind the scenes. We built on the idea of comparing the current document with the parent contact descendants and started prototyping a sticky footer that would display the possible duplicates. An idea that eventually turned into a working proof of concept. Next slide, please. So raising an issue. After interacting with the CHT team on the forum, it was clear that this was something that could benefit the larger community. Creating a feature request was pretty simple. CHT provides thoughtful templates with helpful examples. In our case, most of the context needed to open the issue could be derived from the forum thread, where we've already discussed everything at length. So the transition felt pretty natural. The PR and review process. Once we had a proposed solution, we opened a pull request. The CHT team did an incredible job of quickly understanding what we were trying to achieve. They helped guide and refine the implementation, simplified the logic, and ensure it integrated cleanly into the broader system. Special thanks to Josh and Gareth for their continued support throughout that process. As part of this work, we also needed to make a small change to the CHT const tool to support the properties expressions. But by then, we were more familiar with the PR process, which made contributing those additional improvements smooth and straightforward. Alrighty, next slide, please. All right, let me quickly share my screen and get into the demo. There we go. Can everyone see my screen?
Looks
Perfect.
good.
Yes, we can see it.
Awesome, thank you. So the default matching strategy is applied to both places and people, and it checks for two things: name similarity and date of birth. The name check uses the Levenshtein distance algorithm with a threshold of 3. This simply means that strings are considered similar if it takes 3 or fewer changes to get the source string to match the comparison string. And then if date of births are available, the system checks that they are within 1 year of each other. So in this scenario, we're working off of CHT's default project. We have a health facility, 4 people, and 2 areas captured underneath it. Let's consider those 4 people quickly. You notice here that test person 1 and test person 2 are deceased. Take note of their ages, as well as that spelling. You'll note that test person 2 is missing that O. Then test person 3 has the same spelling as test person 1, except for that last digit. And then tester person differs more significantly. We'll get back into that in a second. Let me just move those across quickly. Now let's try to create test person 4. Oops. This is going to be a patient that is today years old. And on submit, let's see what we can observe. Alrighty. So we only displayed 2 possible matches. You'll notice here that the ceased contacts are included by default. Test person 3 differs only in that last digit. Remember, we're creating test person 4. Test person 2 differs in that missing O as well as that last digit. So 1 insertion and 1 change for 2 changes overall. Both of these items fall within that 3 threshold we talked about earlier. Test person 1 is not a match. The date of birth is 13 months ago, which is just outside of that 1 year window we discussed earlier as well. Remember, the person you're creating now is today years old. Then tester person is also not a match, which requires more than 3 changes. 2 insertions, E and R, remember tester, 1 change to a capital P, and then 1 deletion, that missing training digit. So that's a total of 4 changes, and that's why it's excluded here. Finally, you would have also noticed that the current contact you're creating is also not in that list. And that's to be expected. I mean, the form contains all that information already. You can expand each potential duplicate list tile to later load that contact summary information. So here you can review that information. This is all configurable. And then you can click the open button to navigate to that contact. Alternatively, you can make some changes to this form. And upon doing so, you'll notice that the red border around the duplicate section will actually disappear. And that's to signal that, these matches may no longer apply. Finally, you can go ahead and proceed with the submission by clicking the checkbox at the bottom. Alrighty. So I mentioned this earlier, but the duplicate section is a sticky footer. This means that even if your form spans multiple pages, the section remains visible. And that helps you compare details across different pages to the potential duplicates. So let's quickly try and create area 3 to showcase this. Alrighty. Quick previous, you can see it follows you around. So let's just imagine that your name and description was on the first page, and then your notes and external ID was on the second page. You'd easily be able to compare them. All right, but there's a little bit more to it than just that. Matching uses the parent's ID as a lookup, and the parent document's contact type is used to filter potential matches. So if your place can contain multiple contact types, so places or people, the results will be filtered by parent ID and contact type. So let's try create a person with the name area 3 to showcase this. Also today is old. in the patient. You'll see that submission went through without a problem. And that is because area 3 is compared to the other person docs and not the other areas. Remember, the form you were creating was a person, not an area. The functionality behind retrieving duplicates uses 2 views: context by parent and context by type. Let me move the window again. Sorry about that. So the context by parent is used, is the one used mostly. That has the parent ID here and the contact type over here. So here you can actually see all the people we've spoken about during this demo and those 2 areas. Context by type, though, that's used when comparing the topmost place that has no parent ID. Over here, that would be our health facility. And usually there's only a handful of those, so the lookup should be very quick. So apart from this, the matching strategy can be changed to anything you need to identify duplicates in your context. Just set or update the duplicate expression value in the specific contact form.properties file, your specific contact form.properties file. Righty, I think that's it for this demo. Back to the slides. Thank you. So to wrap up this monologue, I just want to highlight something truly special: the CHT community. The work spanned several months, but we were never alone in the process. From forum discussions to GitHub threads, we could always rely on a rich pool of knowledge, guidance, and collaboration. As mentioned earlier, we eventually realized that our initial approach, while viable, was likely too complex. The declarative structure we envisioned may have made it difficult for other implementers to write and manage the matching expressions effectively. So what I'm trying to get at is, your first try does not have to be perfect. Of course, the CHT community values working examples, but they also value collaboration. If you can clearly present a use case or a challenge, they'll help you shape it into something viable. And don't be afraid to experiment and break things, just maybe not in production. By diving into the code and understanding how the pieces fit together, we found solutions not only to our immediate problems, but also improvements that could benefit the broader community. So in close, as Mr. Jones put it, this has been an amazing collaborative journey and a thing of real beauty. For us, that does not just refer to this contribution, but partnership that blossomed from it. Thank you.
Anro, thank you. What an excellent presentation, flawless demo. We're going to pause here for a second to get any questions or comments from anybody. I just do want to say, first off the top, though, I loved how you pointed out at the beginning the purpose of one of the goals with the CHAMP project was to just stay out of the way of the CHW and let them do their work without hindrance. And I think features like this duplicate contact prevention really kind of serve to support that directly in coming up with a way to integrate with the workflow that's very natural, and gives you all of the information you need when you need it, and nothing that you don't need. So awesome work here. And I'll kick us off with a question to start, and then we'll go to the room. For you, Anro, you mentioned the duplicate contact detection finds contacts that have the same name and age approximately. What if I have different types of contacts that maybe require a little bit of a different matching strategy, right? I don't care about the age. I do care about another custom field that I have, and I don't want 2 contacts to share that.
Yeah, so you can specify all the properties you want to compare in your .properties file in that duplicate expression value. So you can compare ID numbers, phone numbers, sex, date of birth, everything that's specific to your context and you want to use to match these expressions or to match these contacts. You can set that, and you can set that specific to each level of your hierarchy. So it's very configurable. Thank you for that question. I hope that answers it.
Yeah, that's awesome. What else? Any other questions, comments from the room here?
Thanks, Anro, for the presentation. Quick one. I think in one of the slides, you mentioned that you are on an old version and you couldn't take advantage of some of the features that are available. I would be interested to know if if the project has upgraded to one of the latest versions.
Yeah, unfortunately, we're still in the older version. We're busy with the upgrade though, and we've made some real strides in doing so. I think we're currently aiming for 4.15. So I know it's trailing by a few versions, but we're on 4.3, I think, at the moment. So it's quite a bit of a jump. We're just going through, rigorous testing and making sure a bunch of our moving parts are in place. Like, for instance, the database backups and that sort of stuff, and the restore process. And yeah, we're testing a bunch of things. We'll get there, hopefully very soon. Oh, yeah, I just wanted to note as well, this functionality does not work just on the create, it also works on the edit. I think I'm going to stick that with that.
Perfect. Wonderful. Thank you for that presentation again, Anro. And just FYI, this was released in 4.19. I think we'll get to that. Ashley may tell us about that when we slide into the next section here. But it is on by default. So as you take the upgrade, your users will be able to kind of experience the benefits by default of this duplicate contact detection. There is, of course, the option to turn it off if it is causing problems. But yeah, hopefully this is going to be something very useful to the broader community there.